Effects of cannabis addiction. Cannabis is a plant that we commonly call marijuana, ganja in herbal form or hashish in resinous form. It has been commonly used way back prehistoric times. However, its use became prevalent in the 20th century when cannabis was utilized for religious, spiritual, medicinal and even recreational purposes. It was then that its possession, use or sale was prohibited. To date, the use of cannabis for drug use or cannabis addiction remains illegal all throughout the most parts of the world. Psychologically, cannabis is already a recognized addictive drug. Cannabis addiction occurs when one's mental and physical state are prominently altered due to its consumption. Although in Diagnostic and Statistical Manual of Mental Disorders, DSM-IV, there is no cannabis withdrawal syndrome, evidences show that cannabis addiction induces similar withdrawal symptoms to other drug addiction. But unlike tobacco, cannabis addiction has not shown to cause lung cancer, chronic pulmonary disease, or emphysema. It does not also cause birth defects to expectant mothers who are hooked to cannabis. Basically, cannabis addiction is less hazardous than addiction to tobacco, prescription drugs, or alcohol. Different users may experience different effects in cannabis addiction. Factors such as the dose, its potency, its chemical composition, or its method of consumption are what elicit different levels of high in cannabis addiction. Long-term effects include a feeling of euphoria, intense relaxation, laughter and giggle fits, increased appreciation for music, and either a feeling of intense pleasure or anxiety. Forgetfulness, laziness, distorted perception, rambling, troubled concentration, inability of motor coordination, increased heart rate, spiritual talking and paranoia are some of the short-term effects of cannabis addiction. It is also shown to manifest its ill effects on the hippocampus, the part of the brain linked with learning and memory, thereby causing short-term memory impairment. Cannabis addiction has also been associated to other mental illnesses, from psychotic episodes to clinical schizophrenia. Nevertheless, there is always a way out of cannabis addiction. The steps may be simple yet hard and requires extreme sense of commitment and dedication to move out of this addiction. Be willing to feel whatever painful feelings and take part in being responsible for them. Instead of avoiding them with your addiction, face them. Be conscious that you want to know what is causing your pain. Discover the thoughts and actions causing your pain. It should just come from within. Perseverance, will and devotion is all that it takes.
For more content like this, please visit learnforfree.biz.
Content produced and distributed by AllSuperInfo. All rights reserved.
Discover the proven formula for automated sales and success that you can apply to your business in under 30 minutes.
Reserve your seat at allsuper.info/webinar.